Let's bring in right now former White House Chief of Staff under President Clinton, Mac McLarty. Mac's the co-chair of the Council on Foreign Relations Independent Task Force on U.S. Immigration Policy, which released a report on how broken our immigration system is and how it threatens the nation's economic and national security. Also with us, a guy we found on the street, Lawrence O'Donnell. Thank you, gentlemen, both for being with us.
By.
Mac, thank you for being with us. You know, yesterday I was thinking it would be great to have you here, and also Lawrence, because you guys were both there in '93 and '94, the last time Democrats tried to launch health care reform. Do you see any similarities on the ground politically between now and then, and any warning signs that President Obama should take note of?
Well, I think Nancy DeParla, who's heading up the health care effort, was also there, and I think there were some lessons learned, Joe. I don't think there's any question about it. Of course, a lot of presidents, as you know, and as Lawrence knows, and all of your colleagues there know, have attempted health care reform, and not many have succeeded. I think President Obama has a real chance to move forward on health care reform. I think the lessons are that he put a broad proposal there for the Congress then to discuss, evaluate, make changes. I think he's cast a wide net, and I think right now the health care initiative is positioned well. The issue, Joe, is cost. That's the issue. That's where I think the real debate is going to come down to this time, much more than the policy itself.
You know, Mac was, of course, running the White House. You were working with Pat Moynihan, who played such a huge role in the Senate. Chairman Moynihan. Tell me about the similarities between what you see now and what you saw in '93, '94.
I think the dynamics are virtually identical. There's been a shift, a policy shift to the left, a significant one, because as Mac remembers in '93, '94, the central question was, could we get an employer mandate, which was in the Clinton bill. That's what died. That's what could not get through the House. That's what could not get through the Senate Finance Committee. It got 4 votes in the Senate Finance Committee. Max Baucus voted against it. Right now, Max Baucus is the chairman of that committee. He's in favor of an employer mandate. He's in favor of an individual mandate. Those are the hottest items back then. Cost has always been a problem. The biggest difference, though, the biggest difference between now and then is very simply Barack Obama. He was elected with a real mandate. Bill Clinton got in with 43% of the vote. And Mac, I don't know if you had this conversation with Kent Conrad, but when Kent Conrad, then on the Senate Finance Committee, one of the really solid Democrats, I started talking to him about rounding up votes for Clinton health care, and he listened to me very politely, and when I finished talking, he said to me, you know, Bill Clinton came in 3rd in my state, and, you know, behind Ross Perot, and that's when I realized, oh, wait a minute, we are trying to push far beyond Bill Clinton's electoral mandate. Obama has an electoral mandate, and he has now Al Franken, the 60th vote. They've got a new level of power.
Happy days are here again. Mac, let's talk. You bring up a very fascinating point. In 2009, deficits seemed to be a bigger problem. In '93 and '94, it seemed to be Americans being concerned that their doctor was going to be yanked away from them. So that is quite a different dynamic, isn't it? Do you agree with Lawrence that in some ways America has moved a bit left on what they want from Washington health care?
I think there's a better understanding of health care, Joe, just respectfully. We inherited some deficits, too.
Oh, big deficits, right.
We tried to address them and of course, left with a surplus, which we're quite proud of. But I think this time you have a very different dynamic. I think Lawrence reconstructed it just right. I think not only was President Obama elected with a mandate, Joe, but I think you also have the American people in a very serious frame of mind about a number of issues, and you also, on the health care issue, Joe, a very distinct difference. You have a much broader possibility to gain broad business support for health care. That was not the dynamic in 1994. And, of course, we had expended a lot of capital, as Harold and others remember, and Lawrence, of course, was right in the center of it with Chairman Moynihan, on the economic plan and the deficit reduction plan, and of course then we went right into health care. That was a difficult,
Mac,
second step.
That is, I think that's one of the great parallels politically. You look at all of the political capital you guys had to extinguish to pass that deficit reduction plan and the tax increase, which was part of the whole plan, and then you did health care. the president, this president, has had to extinguish some political capital on the stimulus plan, on his long-term budget, on cap and trade, on bailing out Detroit. He's also had to extinguish a lot of capital, and now he finds himself approaching health care in a similar situation as you all, climbing some huge mountains before getting to the biggest peak of them all.
Well, as I said, every president that has attempted health care reform has had a very high mountain to climb, and no one's really scaled it really successfully. I think President Obama has a real chance to do that. I hope, Joe, he'll be able to do it not just with the 60 votes that you noted, but on a bipartisan basis. The American people feel much better about these major reforms in critical areas in their lives if it's done on a bipartisan basis.
Boy, I couldn't agree more, especially on something as huge as health care. It just can't be
exactly
a one-party solution. Hey, Mac, thank you for being with us. It's great to have you here. Hope you'll come back.
Joe, look forward to it. Thank you. My pleasure.
Thanks. He is a great guy.
He's the nicest guy who ever worked in the White House. The nicest guy.
So thoughtful.
Yeah.
He was a pleasure to work with.
Yeah. You know, he didn't say that about you.
No.
He said you.
No, I think if you gave him time. Mac, are you still there?
Mac,
Mac
was here.
I'm still there. I feel like, Lawrence, I've got to come to your defense here with Joe.
Give Mac the floor. Take your time. Go ahead.
Yeah, cut his
Mac, he's crazy.
I'll filibuster.
Okay. Mac, thanks so much.
Okay,
Great to
Joe,
see you.
thank you.